So when can you stop taking it, if ever?
Some people actually wonder whether their epilepsy has actually gone away or not after they've been on medication for many years, and if their epilepsy particularly has been very mild anyway when they first went on to medication, and they often wonder whether they should come off the medication or not, and they consult with their consultant, they discuss this issue with them. Often the consultant will say, yes, you can come off it if you want to. But the common question is, well, will the seizures come back again? And the consultant is quite right when he says, or she says, well, they actually can come back again. We actually don't know that definitive answer.
When I was first prescribed medication, my doctor said that after an extended period of no seizures, we could possibly stop using the medication. However, I've had to gradually increase it, in fact, because of seizures increasing, and I'm not prepared to stop taking the medication.
The medication I've been on has been working for me. I've been seizure free. I don't want to come off the medication in case I have any other seizures. I've discussed this with the fire brigade doctor, and he was wanting me to stay on the medication. He would advise me to stay on the medication, and I've decided that I will.
The outlook for most people with epilepsy is very good. As we've said, 70% of people with epilepsy can expect their seizures to go away. Some people may have heard on the radio or in the newspapers about the risk of death from epilepsy, and indeed there is a risk of death if one has seizures, particularly severe seizures that affect the whole of the brain. We call them generalized seizures that occur at night. And regrettably, some people die of what we call sudden, unexplained death in epilepsy, SUDEP. How do we reduce this? Simply by reducing or stopping the seizures. And so any decisions about treatment, any decisions about how to manage the epilepsy must be borne in mind.
It's a really difficult decision whether to take anti-epileptic drugs or not, and it really is about getting as much information as possible, working with the team of healthcare professionals that are working with you, and really being able to make an informed decision about what's best for you. There's no doubt about it. Some people will immediately want to take anti-epileptic drugs. They won't have any worries about that at all, yet there'll be always some that have some fears about them. However, they need some balanced information about what the risks are to them if they decide not to take any anti-epileptic drugs at this time.
If people are worried about taking medication generally, I would say that what you need to look at is your quality of life and how you think that would be affected by seizures versus how you think that might be affected by taking medication. And really, it's weighing up what matters most to you and what you can cope with and adapt to. Most people actually don't find it that difficult to take medication once they get into a routine of it, and they appreciate that actually it's the best chance they've got of controlling the seizures.
I'll be in practice tomorrow morning. There's been a lot of research done on why people don't take medication. It does seem to be about people's beliefs about whether they want to be on medication, how the medication works, and really a balance of the benefits of taking medication against the drawbacks. We know that up to 50% of people on occasion may not take their medication. Please tell us about any concerns or worries that you have.